So today it's a straightforward agenda. I'll be going over kind of an overview of our reinsurance program, which is the main or the program under our existing 1332 waiver. The context I think will be helpful as we talk about then the waiver application, amendment application. And then we'll have our public comment period, and that will be all for today. So we had circulated a Google form for anyone who'd like to comment, but don't feel limited by that. If you didn't get a chance to sign up, anyone is welcome to comment during the public comment period. So on the next slide, we'll get started with an overview of the reinsurance program. Next slide, please. So in 2014, the Affordable Care Act went into effect, and as a result, rates doubled between 2014 and 2018. They doubled so much that enrollment declined significantly. So the double-digit increases, had an impact on enrollment. And then in 2019, we implemented the reinsurance program as a way to stabilize the individual market. That was successful, and since 2019, when the program began, rates are down more than 20% compared to beforehand, and enrollment has rebounded. So on the next slide, I'll tell you a little bit about how reinsurance works. So the reinsurance program basically reimburses insurers for a portion of high claims costs. So if a consumer incurs over a certain dollar amount of claims costs, the state begins reimbursing the insurer for a percentage of those claims up until a certain capped amount. So that's what you see here on the slide are those parameters for the program. The MHBE board sets the parameters every year and includes that what we call the attachment point, which is when claims begin being reimbursed, and then the coinsurance rate at which claims are reimbursed, and then the cap. We also include something called the dampening factor, which is meant to account for the interaction between the reinsurance program and the federal risk adjustment program, both of which cover claims for high-cost individuals. So the dampening factor is our answer to any overlap between those two programs. Next slide, please. So the reinsurance program scope is on this page. The total paid claims, and this is for 2022, but it still gives you a sense. Total paid claims were about $1.5 billion. And 94% of enrollees who did not qualify for reinsurance payments accounted for 34% of paid claims. 6% of enrollees who qualified for reinsurance payments accounted for 66% of paid claims. And so the reinsurance program reimbursed about half of those claims, and then the other half was covered by insurers. Next slide, please. So on this slide, we can see how the reinsurance program has reduced premiums successfully. As I mentioned before, premiums are down. They're down more than 20% compared to prior to the program. And our premiums here in Maryland are the lowest cost plans. They're lowest cost compared to US averages, about 25 to 30% below US averages, depending on metal level. On the next slide, we can see the impact on enrollment. And I will say that we can't attribute all of this enrollment growth to the reinsurance program necessarily, because in recent years we've had other factors in play, like enhanced premium subsidies through the American Rescue Plan Act. So since 2019, on-exchange enrollment is up 36%, and then in the market overall, on and off exchange, that enrollment is up as well by about 33%. So on the next slide, I'll just give a little background on our reinsurance funding. The funding comes from state and federal dollars. We have a state health insurance provider fee that replaces an old federal assessment. And since 2020, it's been a 1% state assessment. And then federal funding comes from this waiver that we already have in place. So the federal government, as I mentioned, subsidizes individual market premiums through the premium tax credit. And that tax credit caps the consumer's expected contribution at a certain percentage of their income. The 1332 waiver allows us to reduce the federal cost to subsidize premiums. And so since we are saving the federal government that money, the savings are passed through to us, to the state. And so we are recouping those premium costs that we save through the reinsurance program, and they are sent back to us through pass-through funding. So we call this the federal funding, we call it pass-through funding. So that's important to know. On the next slide, we have so this chart is as of July of 2023. So we will soon have more up-to-date projections, but just to illustrate the breakdown of our funding sources, you can see the federal funding is in green. So the early years of the program were funded entirely with the federal pass-through money, and then that allowed us to save some of that money and state money for future years when maybe our annual revenues were not enough to cover the cost of the program in that year. 2022 was the first year we had to draw down on our reserves. As I mentioned, we will have more up-to-date projections for the reinsurance program later in July. So if you're interested in a more detailed presentation on reinsurance costs and funding, please feel free to join us for the annual forum. That'll be on July 16th. So look out on our website for more information about that. So now that I've given some background on the reinsurance program, on the next slide, we'll begin discussing the amendment application. So here I've laid out the contents of the application. If you haven't already accessed it, you can find the draft application on our website, but it contains these items here: a description of our request, description of the public notice and comment period, description of our sufficient authority under state law to be doing this, high-level implementation plan, analysis of the impact on our of the guardrails for the Section 1332 waiver, and then the estimated impact on pass-through funding, and many appendices. So next slide, I'll just get started telling you about the first section, which describes how, as you know, the General Assembly passed the Access to Care Act, directing us to apply for this waiver amendment to allow all residents to enroll in plans on exchange regardless of their immigration status. And so in order to do that, we will be, the proposal is to waive Section 1332 F3 of the ACA. As I've mentioned, we already have a 1332 waiver that facilitates the reinsurance program through 2028. Our request to the federal government is to waive this specific provision of the ACA through the rest of our waiver period. And the change should be effective for people to enroll regardless of immigration status, beginning during open enrollment for plan year 2026, so November 2025. On the next slide, we just describe the portion of our request where we note that about 112,000 Marylanders are uninsured and ineligible for coverage due to their immigration status, which is about 30% of Maryland's uninsured population overall. Currently, this population is eligible to enroll in full price plans off the exchange, but if the waiver amendment is approved, they'll be eligible to enroll on exchange. However, newly eligible individuals will not be eligible for federal or state subsidies. And then on the next slide, so although the new population would not be eligible for subsidies, there are many benefits to enrolling on exchange. The first is simplified shopping experience, We have many tools for comparing plan costs, for checking whether certain plans include certain providers or drugs, and for estimating total healthcare costs under different plans. We also offer extensive consumer support. The call center can assist consumers in over 200 languages, and navigators and brokers provide in-person assistance. And lastly, the fact that mixed immigration status families will be able to enroll in the same plan together should streamline things and allow for continuity of coverage, allow families to save costs in the form of sharing a deductible, an out-of-pocket maximum, and then reduce the administrative burden of having to manage multiple plans in the same family. The public notice and comment period section of the application is very straightforward. We are currently in the 30-day comment period. It ends on July 9th. This is the first of 2 hearings. The second will be on July 3rd. We posted notice of these hearings 30 days in advance. The public can submit comments to the address on the slide here, and we will be including a summary and materials and all the comments from these hearings and the comment period in the final submission of the application. The next section discusses our authority under state law to apply for the amendment. This first bullet here references the legislation that allows or that directed us to originally apply for the 1332 waiver and establish the reinsurance program. And then in 2024, the reason we're here is the Access to Care Act, in which the General Assembly directed us to apply for this amendment and to allow Maryland residents to enroll in private plans on exchange regardless of their immigration status. The bill included some technical amendments to the insurance code. And then, yeah, like I said, directed us to implement a new program. So to implement on the next slide, to implement the new program, we anticipate or we hope to receive approval of the request by December. And then in 2025, March through August will be our main kind of design and testing and finalization of systems changes. The design will start in March. Summer will be when we finalize the system updates. And then, as I've mentioned previously, the anticipated implementation date will be for 2026 plans. So beginning for open enrollment for that plan year in November. So, and then the coverage will begin for the new population in January of 2026. A key part of the application is an analysis of the impact on what's called the 1332 statutory guardrails. The first is comprehensiveness, meaning that under the waiver or waiver amendment in this case, we must provide coverage that is at least as comprehensive as the coverage provided without the waiver. This application doesn't include any requests to change coverage or change essential health benefits, so there's no impact to that guardrail. The second guardrail is affordability. So under the amendment, we are required to provide coverage and cost sharing protections against excessive out-of-pocket spending that are at least as affordable as without the waiver or waiver amendment. And indeed, the amended waiver would not change out-of-pocket costs or raise premiums for enrollees. The third guardrail is coverage. We must provide coverage to a comparable number of residents as without the waiver or waiver amendment. And we determined the amended waiver would not impact the coverage of individuals who were already enrolled prior to the amendment. And in fact, the newly eligible population will lead to an increase in coverage. And lastly, we are required to not increase the federal deficit. And we actually believe that the amendment will immaterially reduce premiums and reduce the federal APTC liability and the federal deficit nominally. So all good news on that front. On the next slide, I'll talk a little bit more about this idea of pass-through funding. So as I mentioned on the last slide, the amendment is expected to immaterially reduce overall premiums. Research indicates that those eligible but for their immigration status are healthier than the general population, controlling for age and other factors. And also those eligible but for their immigration status tend to be younger than the individual market population overall. So we don't anticipate an impact from anti-selection and pent-up demand because of the fact that this population could technically already purchase individual market plans only off exchange. So we're not anticipating an impact from that. And then although the reduced premiums reduce the federal APTC liability somewhat, we are not requesting pass-through as part of this waiver amendment. So the only pass-through we will continue to receive is as a result of the reinsurance program, not from this amendment. And then on the last slide, I just want to go through our timeline for the rest of the waiver amendment process. Like I said, there's a second public hearing. I think maybe on this slide, it should say July 3rd is the next public hearing, but it's right everywhere else. And then our board will vote on in mid-July on whether to submit the application to the federal government, and then we will do so pending board approval. As I mentioned, and this isn't part of our amendment process, but we will probably touch on this a little bit during our reinsurance forum. We hold that annually to talk about, the last year of reinsurance program performance. And then later this summer, hopefully, we will hear back from the federal government about whether our application is complete. They will hold their own 30-day public comment period. And then technically, the federal government reserves the right to take 180 days to decide whether to approve our application or not. We have requested a decision by the end of this calendar year, but they do technically have until the end of February of 2025, or almost the end of February. Then, as I've said before, open enrollment starts for plan year 2026 in November of 2025, and then coverage for 2026 begins on January 1st, 2026. I believe that is all I have for you today. I, in my records, have 3 people signed up for public comment. So I'm going to go ahead and call on those people now. This is also, if anyone has any questions, I'm happy to take those. First up, we have Stephanie Clapper with Maryland Healthcare for All Coalition.
Thank you, Becca. Yep, Stephanie Clapper from Maryland Healthcare for All Coalition. We are made up of hundreds of faith, business, labor, community, and healthcare organizations from across the state, all working together toward access to quality, affordable healthcare for all Marylanders. We wanted to take the opportunity to thank the Maryland General Assembly and Governor Moore for passing the Access to Care Act and signing it into law, and to commend Maryland Health Benefit Exchange for this application draft, and to express our strong support that this is going to provide a simplified shopping experience for immigrants, advanced technology to identify plans that they didn't have access to before, extensive consumer report, unique plan options, and the ability for multi-status families to apply for coverage together. And we are just very excited about this. I wanted to thank you for your hard work towards it, and for getting it up off the ground as soon as possible. So thank you very much.
Thanks, Stephanie. Next, we have Ninfa Amador. And if everyone could actually state their organization as well when they introduce themselves, that would be good. Thank you.
Sorry, you say Ninfa. I'll be representing CASA for today.
Great, thank you.
Yes, good afternoon. My name is Lady Garcia, and I'm the Senior Manager for the Navigational Health Social Services at CASA, Maryland's largest organization for immigrant and working class families. Today, on behalf of over 155,000 members who have voiced that access to care is the most critical opportunity in improving their quality of life, I share comments supporting your most recent 1332 waiver application. Of the many social services programs we provide at CASA, last year alone we assisted over 55,000 Maryland residents with vital health navigation services, including enrollment assistance for ACA. The population CASA serves are mainly uninsured and excluded from the formal healthcare system almost fully because of the immigration status. During my 10 years at CASA providing essential health and social services, 2023 had the biggest impact on my team. The Healthy Baby Security Act expanded health coverage, allowing hundreds of families to get insured for the first time during a critical period in their lives. Although Maryland has made progress in prioritizing health equity, little has been done to address access to care for the nearly 5% of our population who are undocumented and uninsured, comprising about 30% of the uninsured population in Maryland. We appreciate the effective implementation of the Healthy Babies Equity Act, which has significantly improved the lives of over 6,000 babies and parents since its implementation last year. It is also a financially prudent way to ensure that both patients and our hospital systems are not strained by high medical bills incurred by hospital stays for acute illness and that uncompensated care costs are managed. If this waiver is approved, Maryland will be a good company supporting and providing healthcare access to immigrant community. Most recently, the Biden administration expanded the coverage of the Affordable Care Act to DACA recipients. Individuals considered to be living, working lawfully in the United States were denied coverage due to their immigration status. In 2022, Washington State also submitted a 1332 waiver to allow Washingtonians, regardless of immigration status, to access the state's health insurance marketplace. Across the country, state and local programs have also opened eligibility for purchasing healthcare regardless of immigration status. Within the Maryland General Assembly's leadership in the issue, particularly the chair of the Finance Committee, the Health and Government Operations Committee, and the bill sponsors delegate Coalition and Senators Hayes, who made the waiver application possible. Did someone had a question? I'm sorry, I heard that someone raised a hand. We thank you for the past work expanding healthcare. Your support has ensured that Maryland gets closer to ending the inequality of the healthcare space. We look forward to seeing healthcare expansion for our immigrant community through an approved 1332 waiver, which could permit individuals to purchase a product that could mean the difference between life and death. Thank you for your time.
Thank you so much. Next, I have James Caldero. If James isn't here, I'm happy to open the floor to anyone else who'd like to comment. Nishana?
Thank you. Good afternoon. My name is Nishana Kess, and I'm the Executive Director of the Maryland State Conference of the NAACP. We express our support for 1332 waiver to waive section in particular 1312C1 of the Affordable Care Act. This waiver is essential for allowing immigrants to purchase health insurance through the health care exchange at comparable and competitive rates, a fundamental right that should be accessible to all Marylanders. Section 1332 waivers permits Maryland to implement innovative strategies for providing residents, including immigrants, with access to high quality, affordable health insurance while retaining ACA protections. This waiver meets all statutory requirements. It ensures comprehensive and affordable coverage, maintains or increases the number of insured residents, and does not increase the federal deficit. Allowing immigrants access to the healthcare exchange benefits everyone. It provides comprehensive coverage, reduces emergency room reliance, and lowers uncompensated care costs. Immigrants would have access to the same qualified health plans as other residents, ensuring affordability and financial protection. Moreover, by expanding the pool, we stabilize premiums and reduce overall costs, promoting public health and economic strength. This waiver aligns with ACA's goal of health equity, creating a more just and inclusive society. The Maryland State Conference of NAACP fully supports this waiver as a step towards health equity and justice for all residents of Maryland. It is time to ensure our immigrant neighbors have the same opportunities to live healthy, productive lives as everyone else. Thank you for your time and consideration.
Thank you so much. Does anyone else have comment? Stephanie.
I wanted to applaud the previous two speakers, but I hit the wrong button. So anyway, applause.
Lovely, thank you. Okay, well, in the absence of further comments, this concludes our first waiver amendment public hearing. If you have written comments you'd like to submit, please send them our way. Stay tuned. You're welcome to join for the second hearing if you'd like. It'll be more of the same. And I thank you all for joining us today, and thanks for your engagement.
Thank you.
Thank you.
Second.